All right, everyone. I want to thank you for joining me for this Manor COVID-19 informational brief. The real intent behind this brief is to hopefully just provide everybody within the community a level of assurance that the city is working very hard and diligent to be proactive during this pandemic. You have two different types of leadership. You have those that are leaders that are out in the front, and then you have managers. And during this crisis, we cannot manage. We are leading from the front. We are leading uh, with different types of conversations that are going on to make sure we are going to bust through this pandemic situation with everybody aboard and along with as little setbacks as possible. So I know many of you all do not receive the type of information that we are receiving within City Hall. Uh, and so this is an attempt to basically try to give you all some understanding of the type of information that we are receiving, that I'm receiving every morning, afternoon, and evening throughout this whole situation. And so I kind of broke it down into different little sections to be able to show you the different information we're gathering from national to state to county. And then from there, being able to really not just create our own pandemic emergency response plan and the team that comprises executing that plan, but more so of this information that's guiding us and how can we try to make sure that we do not get too overly focused on what is happening in one part of our county and discounting the information that may be going on in other cities, that may be going on in other counties, that may be going on in other states that are very similar to our population. So as you will see, this brief is officially coming from me. The classification legend on this is releasable. So that just kind of goes to show you that we have two other different classifications. One is secret for key personnel. The key personnel are the individuals that are tasked or have been asked to take lead in the city's task forces, as and to include 2 to 3 additional members that those leads have identified need to be backfillers in case for some unforeseen reason they become infected with the COVID-19 virus. And then, of course, the confidential, that's at my level. You'll see where that clarification kind of comes from through the Texas Code 418. But basically, that's information where uh, that type of information is more kind of restricted between myself, chief of police, city manager, superintendent, and board of trustee members, because we're having to do certain types of dialogue and strategic planning to make sure things are in place before you can understand this, before we announce anything, allude to anything, because we want to make sure things are put together so you feel assured and confident. And we don't want you to hear about things that may not come into fruition because there are things that we're planning for that may never come into being needed. So, moving from there, moving on to what the agenda will be. The agenda, as you can see, we're going to talk about from the big perspective, the World Health Organization, just their numbers real quick, which is very key to look at and kind of know. Then down to the situational report summaries. And with these situational report summaries, these are the ones that I receive every morning, every afternoon, and every evening. They come to me and they're consolidated, which you'll see on the slides is kind of taken from multiple different areas from these organizations that they haven't posted. But what you'll see on the slide is really the consolidated version. Most of them are pages up to 20 to 30 pages each of information that's going on, not just locally, but throughout the state, throughout the nation. And then we'll talk real quick about the Travis County dashboard, which is what most of you all are probably looking at as far as what's going on here. And then I'll go over UT model. You should have seen a brief presentation from UT Dell Medical back, I believe it was on the 23rd or 24th, regarding the curve of this pandemic and trying to push that curve out to as far right as possible, as well as the need for the 90% reduction, which is equivalent to the shelter in place. So we'll kind of talk about that, some of the slides that are now released, and some of the information that may not have been transmitted between the original presentation and the slides being released. From there, we'll quickly cover some of my conference calls from the national level, the state level, and the county. So, conference calls directly from the White House. I have another one on Wednesday with the White House. State level, I have a phone call. Is mayors and county judges tomorrow with the governor. And then, the frequent county level calls that go on. I have to say that our own county commissioner, Jeffrey Trevelyan, has been doing an excellent job of supporting the different cities here and supporting our needs and being out and present. Whenever asked, he came out to the COVID-19 disaster relief food delivery yesterday, right? And is present, and he spoke and he sat down with Monique Celadon, who's the lead of that, and is going to be working with her to help further streamline this process. So I have to say, without a shadow of a doubt, County Commissioner Trevelyan has been nothing but a great asset for what we are trying to do. And then I'll cover some portions of Texas Administrative Code 418. That is the emergency management code for the state of Texas, which pretty much identifies and lays out how local jurisdictions and emergency management directors are supposed to put together plans, supposed to coordinate within their jurisdiction, and supposed to align resources to assist their entities to be able to get through the situation. And then talking about the the Manor's emergency management plan, and that's just really going to be talking about the different type of task groups we have working different lines of efforts for the city of Manor. As you know, we're small. We don't have that big, robust uh, of a system or a support structure. So we are really having to rely on the community to come together to help in those areas of needs. So I'll kind of cover that a little bit, and then closing remarks. So go ahead and get started with this presentation. So the World Health Organization, I'm going to be covering information from their situational report, which is number 76, that was published yesterday. I actually received a hard copy of this one this morning, but the numbers have not changed since it's the same report. As you can see on this slide, and I'll have to do a little bit additional reading for those that may be watching this on their phone and can't necessarily see all the numbers and the data. The United States of America has a total of 273,000 confirmed cases, right? And then basically total new cases on a daily basis so far, or within 24 hours. So this is a 24-hour report, as you can see on the top right. Within 24 hours, a new number of cases of 32,000 and a new number of deaths equating to 7,000, right? So as you're looking at this, and why is it so key? And it's to get you nervous or to create a concern. What we're looking at when we see these numbers on a 24-hour basis is is the number of new cases, is the number of unfortunate new deaths. Is that number staying the same or is it increasing? Right? Because we want to see a reduction. So we're looking at the national level when we get these reports and we're saying, all right, man, last time they had 28,000. Now we have 32,000. So that means people are not following a shelter in order place. That means there might be territories that are not adhering to the shelter in place, right? And then if you look over here to the right, situation in numbers globally, almost 82,000 new cases within the last 24 hours, 62,000 new deaths. I mean, sorry, 5,798 new deaths within the last 24 hours. So when you talk about this spreading, it's very and highly contagious. This is where we're coming from because we're talking about from 24-hour period. These numbers are huge. I don't want to say huge, but these numbers are not alarming, but these numbers are not good. And we can only ask you to stay away from areas you don't need to go to, because to us, that is the only way to get these numbers down lower. But if you don't do your part, right, how many other people are not doing their part, which creates an issue? So this is what we see from the big, world level as far as the spreading of this of this COVID-19 situation. This is the top level of what we're looking at when I'm sitting in on my White House calls, and some other calls as well. Going next is the situational report summary. So I'm going to kind of cover some discussion between the state and county level engagements. This information is as of April 5th as well, 2020. So when you're looking here, the Texas Division of Emergency Management basically provides information at the multi-county level. And as you can see, that the governor's declaration, disaster declaration, covers this amount of people, 29 million point three. So far, we currently have 484 local jurisdictions in 238 counties with disaster declarations, right? This is not everybody. Again, this is not everybody. So when you're talking about cases, you can look at it. Currently, right now, we're at 127 deaths. Unfortunately, that is a significant jump from about 2 days ago. All right. So talking about the situational report summaries. And with the situational report summaries, again, I was saying that you have this population that is covered through the governor's disaster, 29 million local jurisdictions with their own disaster declarations, 484, and then 238 counties that have done their own disaster declarations. The City of Manor did its local disaster declaration back on March 18th, and the city council extended it through an ordinance to May 1st. So we'll end up having to do another one coming at the beginning of May. As I said before, you have here the total number of statewide cases at 6,812. That's counting about 152 of the counties, with currently about 127 deaths. When we're looking at these numbers here with the breakdown of the unfortunate deaths so far for this pandemic, we want to be looking at the higher numbers, and the higher numbers are also kind of coinciding with the more larger, heavily dense populated cities, right? So you see where we're at as far as Travis County with six unfortunate deaths. Then you have Tarrant County, which has a larger population, Dallas County, which has a larger population. So when you talk about why did Dallas do something and then now Austin might be getting ready to do something, or why did Austin ISD do something, is Manor Independent School District getting ready to do something? Why is this kind of a following the bigger city mentality? A lot of it has to do with because their populations are denser, right? And by seeing what they're doing, the decisions that they're making, reaching out to them and dialoguing with them, which we're doing very heavily now, we're able to understand why they're putting certain measures in place, what trends they're starting to see, and so forth, what planning they believe needs to happen. So we can then take that information and analyze it based upon our actual demographic, our population, and our needs. And that then in turn turns around and enables us to make the right decision for our unique population. All right. Going down to this next slide for the Texas Division of Emergency Management, we talked about the different numbers in testing, and then you have this actual breakdown as far as actual cases. So we definitely have more people. We definitely have more people doing testing than we have as far as actually having cases. And from that, you also see here saying Texas number of deaths is 105 versus what we saw previously at 127. The reason for that is sometimes the communication system and chain of tracking this is not is not smoothed out yet. We're still refining, we're still working on this whole identification, uh, sending of information, documenting information. So you'll probably find the more relevant information, key information as far as positive cases at the county level, and how that information is still getting pushed up to the state level and to the national level, is still being refined and worked out as well. But once again, I highlighted in the last one that the shelter in place stay at home order, that we have only not almost 90% of the population is actually executing a shelter in place or a stay at home order. And that is concerning when we're talking about we need a 90% reduction rate, and that 90% reduction rate is only capable of occurring through a 90% reduction in contact, right? And then you can see over here on the right side that you have these cases, the number of cases broken down. Collin County has 256, Bavaria has 136, Bexar has 342, right? But when we get to this next slide, it's kind of interesting to see that Dallas County has 921, Denton has 273, Fort Bend has 255, Galveston 136, Harris County has 1,106, and you have Tarrant County that and in Tarrant County basically has 383, and Travis County has 430. So when we're looking at that, you see these numbers, right? In Travis County, even though we have more cases than Tarrant County unfortunately has more deaths than we do, right? So it's kind of looking at this stuff at this different level to understand how things are happening in other counties, what things we need to be looking at, and how we potentially need to be able to modify if we see that someone else is having more deaths with less cases, or there's less deaths with more cases, being able to have that discussion. Here within the Texas Health and Human Services report, you can see again they're reporting 127 unfortunate fatalities. There's usually a map that kind of shows a blotter report of where the density is occurring at, and then kind of a breakdown by the counties as far as the cases. Then for Texas Health and Human Services, we have this breakdown. You've seen it on the county dashboard, but here at the state level, you can also see the numbers in the age group by breakdown. And you see majority of the cases spike up at 20 years and starts to significantly decrease at 60 years, right? And when we get to the county numbers, you'll end up you'll end up seeing the same thing pretty much, right? And that's where we want to be able to know and say, just for the county, if the county's numbers are different than what our numbers are, or if the county's numbers are different than what the state's numbers are, why is that? What is the unique circumstance that is going on at the county level that is creating a different population age group to be becoming positive with the COVID virus? Is there a certain different accesses, certain different environments that they're going into that other places are not? In the same way, again, trying to figure out, okay, if this is the same situation and our numbers are lower, what is it that we are doing locally that's keeping our numbers lower that can be utilized as a case to go forward to other counties and potentially the state to help reduce these number of cases across the board? And then now getting to the Travis County dashboard, this number is as of April 5th. And as you can see, Travis County, we worked with the county judge for about 2 days or so to try to get a breakdown by county what the cases were. And as you can see the color code between the number of cases per city, per district for Austin, but it's a better breakdown. And then you can see at the top right, we're currently at 484 cases with, as again, unfortunately, 6 deaths. But when you look at this age group of those that are coming up positive with the cases, you see that again, there's this spike at the age of 20. But for us, it doesn't, from the age of 20 going to 60, and then you see it slowly going back down at the higher 60 to 80 population. So our numbers are very much in sync with the states. So what we're doing is going to be very much in line with what the state and national level is doing because the numbers are syncing together. So therefore, you may see that the city or the county may not necessarily do something right away because we already know through our conversations that the president or the governor is about to do something, and that's pretty much going to already neutralize any individual additional effort that we were going to do, right? And so from here, we're going down to the 5 county COVID-19 projections that was provided by the Dell Medical School. They initially presented this on March 26th, and it includes with school closures and social distancing. What does that mean, this 5 counties? So on the left, you see these 5 different counties plus additional towns and cities that this model was made to provide a guesstimate, right? An estimate with a guesstimate of how things would kind of play out at certain social distancing orders placed out. And so one of the first things that came to play in the graphs you're going to see is with school open, you had for ages 5 to 17 almost 3.7, almost 4 different opportunities of engaging with a new exposure to COVID-19, meaning the classroom is 1, them changing to another classroom is 2, them going to lunch is 3, you know, different populations of exposure. And then that was the highest piece between the ages of 5 to 17, right? And then I highlighted all the other red based on where there's potentially another high opportunity of engaging with someone that may have COVID-19. When we looked at when they looked at work contact, they came up with their model based on data, ages 18 to 49 were almost 5 times likely a day to engage with new opportunities of being exposed to COVID-19. And the same thing you see here almost 3 times a day for those aged 50 to 64, right? So this is where you kind of see the reasoning behind the shelter in place, the stay home. How do we mitigate these daily opportunities for the kids, for our school teachers, for people going to work to naturally remove this high level of potential engagement on a daily basis. Then 3, these other contacts, whether you're going to the grocery store, whether you're going out to eat, right? So you see these numbers again for the kids, 5 to 17, almost an additional 3 times on top of the 4 times. So you're talking about almost 7 times a day these kids could have a new exposure without the shelter in place mandates. You're also talking about your 18 to 49 category, the 3.3 plus so 3 plus 7, almost 8 times a day, new exposures that they could be engaging in, right? Um, so then you have this shelter in place. Let's shut everything down. Let's remove these opportunities of exposure. And almost across the board, you go down to almost 1 engagement per day, up to 2 for some, but almost 1 across the board for everybody. So it becomes very key and crucial to why this shelter in place is very significant and very important, and why the schools being closed is very significant, very important. Why you not going to work is very significant, very important, even though it has ramifications to it. But the intent is to reduce the number of cases that could drastically happen by allowing these opportunities of engagement, right? And so this model was based off of an initial simulation date of March 23. And as you can see, the county judge implemented a shelter in place order on March 24th. And then you look down here at the bottom, reduction of non-household contacts, meaning work or other. You have these four scenarios. And these four scenarios are very equivalent to no ban, 0%, 250 ban, 50% reduction, 50%, 50 or more ban, which is a 75% reduction, and a 10 ban, which is the current 90% reduction effort. So what does this look like, right? Again, no measures. This is the number that was projected from the model that we may be dealing with regarding this pandemic if we did nothing. With the school closures, we got towards a a closer band, right? Maybe a 25% a reduction in social distancing, but it's still not quite enough. Unfortunately, to be able to get to a 50, 75, and a 90% social distancing, or basically we have to have, unfortunately, the schools closed because that is one of the biggest areas of contact. You're talking about, say, just for example, Manor Independent School District. We're talking about 10,000 kids, 2,000 plus employees, 12,000 individuals within a few facilities could potentially become a hot zone for the situation just here within the Manor jurisdiction, right? That's not including Austin or Pflugerville that have other big facilities that have a lot of workers and employees and so forth. So they did this modeling and said, hey, with the schools closed, which we know is for most cities, even smaller cities, the biggest population of gathering individuals, if those are closed, and then we also close working and other activities, we can get down to hopefully a loss of 267 individuals. You look at the difference between the 90% social distancing here within the 5 counties and the 75% social distancing. You're talking about almost 1,200 individuals just by staying at home, sheltering in place, right? Based off of the number and the data. So, what are these graphs that we're talking about? Well, here you go. Is looking at this first graph as far as the cumulative COVID-19 cases. There is a curve. It's going to happen. Our effort is to push this curve as far to the right as possible. Why are we trying to push this curve as far as right to the possible? Because we are waiting for a vaccine to be readily available for mass distribution to be able to fight off this pandemic, to be able to fight off this virus. Without that vaccine to be able to fight off this virus, the sooner that this wave occurs, the sooner that the spike happens, that is the potential for more people to pass away and die. Again, if it happens sooner, basically is what it's saying, right? The 50% social, the 75% social, the 90%. If it happens sooner, at the 50%, we're talking May versus the curve happening in June versus the curve happening in August, right? We're hoping to push this curve so far right that when it does happen, a vaccine is close to being readily available to help mitigate and offset those that may be having those severe conditions. Again, by pushing this farther to the right, we're also hoping that people get more acclimated and accustomed to the shelter in place. They get used to operating in this new way of life for this unfortunate circumstance, right? Um, and so, with that, hopefully, when the curve does happen, it's going to happen to less people because more people are already following and adjusted to this shelter in place way of operating. Next slide shows hospitalizations. Why is it also key to push this curve out? Well, within the 5 counties, we only have so many hospital beds and so many hospitals and facilities. So by pushing this thing further to the right, that is inevitable to happen. The sooner we're able to push this thing to the right, then hopefully we have the vaccine, we have the things in place to be able to take care of the population when if it happens sooner, we do not have the resources, we do not have the capability, we do not have the vaccine, right? Same thing again with ICU beds. We only have so many. And if you look here, even if we don't stick with the 90% reduction, those that end up having to go to the hospital, those that end up having to have need ICU beds, we may not be able to assist and help everybody that we need to because we as a community, we as a county, state, and nation did not do what we needed to do to be able to enable our health physicians, our scientists, and so forth to be able to create the systems, structures, equipment, as well as vaccine needed for when the spike inevitably occurs to be able to save as many people as possible. Then you're looking here at ventilators. Once again, it's the same situation. How far can we push this curve to the right through our acting and supporting in social distancing, in shelter in place, right? To be able to ensure the ventilator production and so forth are not only occurring and dispersed out to the places it needs to be before this natural curve occurs. And then cumulative deaths. I mean, this slide is probably more speaks more volumes than all the others. If you look, if we do not push this curve, if we do not practice our social distancing, if we do not practice the 90% reduction, if we do not make leadership decisions and determine whether or not engagement of our populations is essential. And what is essential? If we do not do that ourselves and we allow this curve, this natural spike that's going to happen earlier than later, we are raising the number of potential deaths that can occur by our own negligence. We have to find the power within ourselves to work together to only do what is essential, what is needed, so we can be able to buy time for our physicians, for our scientists, and all those other systems that need to be in place that are not in place right now to be able to action this pandemic when the wave occurs. And so going from there, I have my frequent conference call summaries with at the national, state, and county level. And when we look at this and we talk about the city of Manor, we're talking about the city of Manor, meaning the actual city limits to include extraterritorial jurisdiction, right? So I don't want anybody thinking that's living within Shadow Glen, Briar Creek, so forth, that our measures that we're doing does not include you. No, this is anybody that's in and around the city of Manor. We are making sure that our task force and our efforts include you, right? So here's an example of some of the conference call summaries that I've had. Social distancing, the push for April. The original shelter in place order went to April 13th. And it was supposed to end April 14 was the 3 weeks for the push here at the county level. The president has extended that to the full month of April because if we do not make that push, if we do not do what we need to do for this 90-day social distancing, then this is what we're experiencing. This push to August does not happen. You see how you're talking about for this whole month of April before we get to May, doing what we need to do. Well, just assume that we're going to have to do what we need to do for the month of April, and then we're going to have to come together and research and do what we need to do in the month of May, right? Because why? Why are we doing what we're doing? We're doing this. We're practicing social distancing because we have to help each other make it to the date the vaccine is available to us. We are helping to make sure those that happen to get it and need to go to the hospital have the resources available. We're hoping that we do not stress out, over stress out those first line responders, those essential workers, before they really need to be overworked because the natural curve is now upon us. Again, you've heard this from the national level that it is projected, even with the 90% in place, about 100 to 200,000 deaths, right? But let this be known too, that number will increase if we do not do what we need to do on an individual level. Again, that number will increase if we do not do what we need to do on an individual level. That number will also increase if we, as leaders of any organization, fail to lead and only decide to manage. We have to take every decision, every data, and move forward together. We have to be proactive and sometimes not have to look at what the other entities are doing adjacent to us. We have, as elected and appointed and employed leaders, to make decisions on behalf of our population, right? It's better to be wrong making that decision than to wait and it's too late. Also, keep in mind that as we pass this curve of the first wave, so to say, after we pass this curve, we still must continue to do our social distancing. If we don't, if we get laxy daisy, we then almost allow ourselves to create this resurgence. So think about it. We get past this first wave, and then let's say all of a sudden we go back to work. We have just now opened the can of worms to allow anybody that may have it now reinfect everybody. So keep in mind that we are working, we are striving, we are doing what we are doing to be able to make it to get more, as many of us to make it to a vaccine is available, right? And then you have here the stimulus. I know many of you are getting information and learning about the stimulus checks and are probably waiting for those to come. Plan as if it will take a while, right? Never, never, especially during a crisis like this, be over reliant upon uh it's going to be sound bad, but never be over reliant upon government. Never be over reliant upon your job. Never be over reliant upon things you have no control over. Find what you can do to be able to self obtain the items you need to. You know, we have different task forces that are working. Reach out to your friends, reach out to other people, and figure out how you, as a community, HOAs, Old Manor, how you all can start to work together to support each other because there will be delays. There will be things that are planned to occur that will not happen. And I do not want any of you to be thinking and waiting on those things to come, and it doesn't come, and then now you are in a worse predicament because you did not plan accordingly, right? Also, the stimulus money will be dispersed out through the governors in major cities. So dialoguing at my level is going to be very key, engaging with the county judge as well as Mayor Adler and Austin and so forth to make sure the needs of the surrounding Austin metropolitan area are taken care of. Now, you've heard me say this multiple different times regarding the vaccine. We are just now going into human trials. Anybody that works within the healthcare space knows it is going to take several months to get past the human trial. If that succeeds, to be able to go into mass trial. If that succeeds, then to go into a vaccine production process. We are looking probably to 2021 of getting this vaccine. So please plan accordingly. Please, these task force that we're putting together is to be able to help assist with some of those stressors that are going to come from us asking you to shelter in place, us asking you to to not go to certain places, us asking you to take on new responsibilities you have not been used to taking on, right? Because we all have to take care of ourselves, and by us taking care of ourselves, we're taking care of other people. And lastly, on here, the COVID-19 is actually a lung targeting virus, right? There's no ifs, ands, or buts about it. It has been identified as a lung targeting virus. Now, when we're talking about vulnerable populations, you have probably started to see within the news that there's requests to have CDC provide breakdown of the demographic population for these cases. You may have seen in the news that supposedly this virus is more prone to African Americans. You know, this stuff is key. We're having these dialogues. We're talking about this stuff, whether it's with the congressional Black Caucus or the White House or whatever, or the county level. We're having these discussions because in this vulnerable populations piece, we need to know who is more susceptible to being infected than others. Because that means if it happens to be African Americans, if it happens to be Hispanics and Latinos, right, then our city is more prone to being infected than some other cities. If it's not those populations, then we know. But there is certain information we are still working to have detailed out, so we at the local levels can be able to work together and be able to make sure our processes are truly taking care of our population. And then, I have not pushed anything out about the Small Business Administration loans, and the reason is because that debt forgiveness in those loans is only for the month of April and the month of May. You still have to pay that debt, so you're basically taking on a loan to pay for payroll when you don't have the customers coming in, and you still probably will have to shut your doors, but now you have an additional debt. If there anybody knows about grants and actual full debt forgiveness loans, that is the information our city needs. That is the information our local business and small business owners need to know about. I'm not in the business of just sharing any type of information. I'm not in the business of just listening to everybody because you know, we have a certain unique type of population, and that population only needs to receive and get the information that is actually tailorable to them. And then again, there's another unique need as I'm having my African American Mayor Association phone calls and so forth, where we're identifying certain needs even for us as smaller cities with lower populations that don't have internal resources and systems, that we're a little bit more reliant upon regional support systems and structures, right? And we've already kind of seen that with the unfortunate closure of our community care clinic, the unfortunate realignment of our local Baylor Scott and White clinic. These things are going to happen. And we are planning through our Manor plan based on these contingencies of what do we have to start putting in place, what do we need to do based upon our population, what things do we need to connect into based upon our population, but then at the same time, what things do we need to plan as contingencies when the things we're supposed to rely on do not come through. Pretty much the same thing I just got done telling you is don't over rely on the government. I'm saying the same thing for us here at the government. We can't over rely on the government. And then what are some of the planning barriers? Uh, the breakdown of the cases, as I told you before. Yes, we have them down by city. Uh, but due to HIPAA requirements, it comes very tricky to be able to identify where within a zip code those spots may be. For us to be able to tell you, stay away from the east side versus the west side of the city, stay away from Old Manor versus New Manor part of the city, right? Those pieces become trickier because the positive cases reported by the county has certain stipulations. But when you self-identify, when you inform us at City Hall, we can still maintain HIPAA requirements, but now we're able to be able to better target where within the city these instances are occurring. This whole crisis, the two key pieces of this whole crisis is this is self-identification and self-quarantining. If people do not self-identify to the proper entities, so we can be able to inform residents where and where not to interact at, then local governments cannot protect the population from getting infected. If individuals who do end up being positive do not self quarantine, then we are not able to basically be able to really utilize any of the task forces and stuff that we have in place because they're set up based upon people self-identifying and self-quarantining, right? And then wanted to talk real quickly before I get into the city's plan, talk about the Texas Government Code 418, which is the state's emergency management ordinance, and it was enacted back on September 1st, 1987. So basically, what it says, slide one, is talking about the presiding officer of a governing body of an incorporated city or a county is basically the emergency management director for that political subdivision, right? Uh, B says they serve as the governor's designated agent in the administration and supervision of duties regarding Texas Administrative Code 418. And also says that that director may exercise the powers granted to the governor under this chapter, and that that individual may also designate a person to serve as the emergency management coordinator. I am on paper sent up am the emergency management director. I receive the morning, afternoon, evening briefs. I get things from different elements in different levels, from the local all the way to the national level because of that designation. Tom Bolt, our city manager, is the deputy. He is serving as emergency management coordinator. So when we talk about most relevant, most key, most up to date information for our city, that is me. That is Tom. For I know that there's other entities receiving information from other areas, but none of them are on calls with the White House. None of them are on calls with Congress. None of them are on calls with the governor. None of them are on calls with the county judge. None of them are on calls with other mayors. So, as far as this pandemic goes, the head, the guidance, the assistance, the coordinator, the information dissemination comes from City Hall. Next is on slide two, local and interjurisdictional emergency management. So it basically says here that we are supposed to create an emergency management plan, which we have, and you'll see that in a little bit. We are still, because like everybody else, never really had one in place, to nobody's fault. Nobody thought this was going to happen, but nobody really had one in place. So there are certain things that if you receive an email or a phone call or an ask from someone from City Hall or from someone from one of the task forces that I have that we'll talk about earlier, they are trying to help not only build this plane while we're flying it, that's what they're doing, but they're also trying to put together and streamline and flesh out what the emergency plan should be for this pandemic, but at the same time, what it should be in the future, right? We're trying to document as we go and as we identify all the needs, right? And so next slide talks about local finance. A political subdivision may makes appropriations for emergency management services as provided for ordinary expenses, may make agreements for the purpose of organizing emergency management service divisions, and provide for a mutual method of financing that organization based on based on things that are satisfactory, right? So we've created these task force. They are aligned to lines of priority or lines of efforts with the city. There will be some things that we may be able to assist with financially because of how they are aligned. But at the same time, there will be things we can't. We are a city that will have to, because we do not have the infrastructure, a city that will have to rely on its own community to come together and help out. We don't have the resources that Austin has. We don't have the resources that Pflugerville has. We don't have the resources that Cedar Park has. What we have is us coming together to help each other out to fill those gaps, right? And then you have here in the local disaster, basically, this is basically just saying the presiding officer of the governing body of a political subdivision may declare a local state of disaster. I did that back on May 18th. And again, it says it's for 7 days unless extended by the council, which they did to the first of May, right? And what it says on the next slide, if you look at F and G, and some people are wondering and had questions on why we have to follow the county judge's guidance. And it basically says here in F and G, if there is ever a disagreement between the mayor and the county judge in an area of declared local disaster, the county judge overrides. All right. And then getting to this next slide, authority to render mutual aid, a local government entity or organized volunteer group may provide mutual aid assistance on request from another local government entity. So the Manor COVID disaster relief group that's being led by Monique Celadon, that was me, a local government, actually asking for assistance by an organized volunteer group. The chief or a highest ranking officer of that entity from which support is requested, with the approval and consent of the presiding officer of that governing body, may provide assistance while acting in accordance with the policies, ordinances, and procedures established by the governing body of that entity, right? And then going into the next slide, most people may be wondering why I am kind of taking lead on the communication efforts for this pandemic. When it came to coordinating information, release of information initially from the two individuals with the Manor Independent School District, when it came with releasing initial information regarding our Walmart. It says right in one, municipalities and counties, right, shall conduct community outreach, including public awareness campaigns and education activities on disaster preparedness. Even though it's supposed to happen each year, once again, I feel it's strong and critical and crucial that you all hear it from your most senior elected official. What is going on? What is occurring? What is rumors? And what is reality and what is true? And then moving down to this section of code, most people are wondering about the confinement ability and the fining. It's right here listed within the code. And then also what's is very important for most of you all to know is personal liability. A member of the Emergency Management Council or the local emergency planning committee established to develop an emergency management plan program in accordance with this chapter, is not personally liable for civil damages for an action arising from the performance of the person's duties on the council or committee. So what does this mean? We have a lot of people out there doing and trying to do great things. If you are not properly aligned with the efforts of this city, you may find yourself liable when you're only trying to help. Make sure your efforts are tied into one of the task force, because the task force are actually designated directly from our emergency management plan and executed by our emergency management team. They will hopefully ensure that you are in line with what we are trying to do to spearhead and be proactive in combating this epidemic, this pandemic, right? So it is very crucial that if you're out there giving food, if you're out there cooking, if you're out there driving people around, make sure you're aligned with one of our task forces. Because if not, you do not have the information we have from FEMA. You don't have the information we have from local government, national government on the do's and the don'ts, the paperwork, the documentation that you need, and the potential reimbursements you may be able to submit for to FEMA. And then disclosure of certain confidential information. Although A for this section, this whole 418 really refers to terrorism and biological warfare. Most of our legislative policies do. Nothing really governs this, but I have been utilizing and executing 418.183 as identifying the dissemination of information, which you saw on the first slide, as far as confidential, meaning only I can release it, only from the office of the mayor. Secret is for task force individual leaders or need to know people. And then unclassified, which this brief is, which is everybody. And now getting into the emergency management plan. for the City of Manor. Once again, it includes the city limits and extraterritorial jurisdictions. It was originally enacted on March 13th and revised recently on March 23rd. The revision came from a great suggestion from Councilman Dr. Chris Harvey of needing a faith-based task force, which is currently spearheaded by Father Alex. So the mission intent, as you can see, is to establish, excuse me, 6 pathways to success during this pandemic. The goal is to create sustainable health and food services, to include educational learning and compliance with local to national guidelines and parameters. And the objective is streamline a strategic coordination and planning effort from the office of the mayor to these other individuals. And what is key about this is, one, the goal, implementing systems and structures, right, based on national guidelines, local guidelines, to be able to self-maintain and self-equip ourselves, right? So if you're not aligned with this emergency management plan, you may not be in compliance with local to national guidelines and parameters. Three, the objective, right? Once again, I'm not talking to everybody. I don't have time to talk to everybody. I don't want to say it rudely, but I don't. And so therefore, there's a system. There's 3 to 5 people I engage with, and those 3 to 5 people engage with 3 to 5 more people. If you think of it almost like a pyramid scheme, that's how it is, but there ain't no scheme in this, right? So information flow. I need to know it all. I don't care what entity you are. I don't care what organization you are. I don't care if you don't think I need to know it. I need to know it because I'm the one that's having these conversations. I'm the one that's coordinating it with our team and the task force and giving them guidance based on additional information that I'm receiving on a daily basis, right? So you can get that information directly to me. If you're one of the key individuals, you can get that information to the task forces. You can get that information disseminated through the city manager, chief of police, the school district, however. But at the end of the day, all information needs to flow up because all information that is being pushed down is coming from the office of the mayor, right? And as you can see, that is fully in alignment with State Code 418. Here are the pathways to success, and as you can see, there's 5 out of the 6. The sixth one, I am not ready to divulge what that one is. We're still planning and coordinating it, so it's not ready for me to provide that information for potential hopes and aspirations by individuals that may not need it yet. But you have the community volunteer program. This community volunteer program, as I said, is spearheaded by Monique Celadon. It's designed to provide targeted assistance to populations designated as vulnerable by the City of Manor. Again, designated as vulnerable by the City of Manor. The next one is the Localized Food Distribution Center. Monique Celadon is kind of spearheading both of these. As both continue to grow, they will be split off into most likely individual people, so they can be able to manage them effectively as they are right now. But the localized food distribution system is structured to maximize city limit and extraterritorial jurisdiction residential needs for designated low income and high need populations by the City of Manor and Manor Independent School District. Okay. And then we have the third one, Manor Independent School District Continuing Education Assistance. That is spearheaded by Dr. Royce Avery and is an attempt to coordinate to ensure the City of Manor youth are constructively active in achieving Texas Education Agency standards while mitigating potential juvenile delinquencies. Now, I know that's a lot of words, but basically what that means is the city has a level of knowledge and information that some of it is TEA, some of it is a lot of different agencies. So coordinating and dialoguing openly with Dr. Avery, the Board of Trustees, to ensure that they are fully in the know of what is going on, what potentially can be coming down the line, and what can potentially occur. The same way as them providing information to us so that we can have that incorporated into our planning efforts. And as we're talking to the White House, the congressional, talking to the county judge, talking to the governor, we can be another avenue in line of effort of finding out information. The superintendent, the board of trustee, they have a certain level of weight. By U.S. order of precedence, when you're talking about governance, the mayor is the third highest ranking person within a state. It goes governor, lieutenant governor, and then mayor. So by doing this and having them align as one of our line of efforts, I'm able to create ruckuses or ask questions that they can't necessarily do, or if they did, may not get the same type of response, right? And then the next line of effort is community social messaging method. This is structured to ensure consistency of official information to mitigate rumors, paranoia, and hysteria via unofficial and unapproved data. And you've seen this. This is one of my very key areas of effort is to make sure you all know as soon as you need to know. And I said it carefully that you all know as soon as you need to know. I do not want to relay too much information of what our planning efforts are or what we may be thinking to create, again, rumors, paranoia, or hysteria. But at the same time, I want to give you enough information so you do not go down the wormhole of listening to rumors. You do not all of a sudden feel an area of inconsistency or feel as if you're being left out to where paranoia and hysteria does begin to occur. You've already seen what has been happening with our Walmart regarding food and items and other places. That happens from rumors, paranoia, and hysteria, right? And then, as I said, the faith-based group, which was created by we created by the recommendation of Dr. Chris Harvey, implemented to support community-wide in individual stressors to serve as an alternative method of receiving emergency management plan feedback and identifying needs at the community and individual level. And this is going to become very crucial. This is led by Dr. Father Alex. And this is key because many of us have never been in a shelter in place situation. For some, we have, whether it's been a deployment in the military or a unique type of job. But for many of us, we have never had to experience this before. And knowing that, we created this group to be able to have a means for moral and mental support, right? And then closing remarks. One, I want to give condolences to anybody that may have lost a loved one or a friend or an acquaintance during this time. So first and foremost, I want to give those condolences out. Next, I want to give my appreciation to everybody that has come to the table to help lead, not manage, but to help lead. And I want to be able to give my appreciation to all the volunteers that are coming out to lead. I also want to give my appreciation to my counterparts in other cities that are making sure I'm fully abreast of what's going on and those within different levels of government keeping me informed as best as possible to keep this community informed. I want to thank you. I also want to give my apologies, my appreciations to the community for following the leadership and guidance that is coming from the City of Manor, from the office of the mayor. And then now I want to get to my apologies. I want to apologize to anybody I may have been short with, and I want to apologize with anyone I may be short with in the future. Hopefully with this brief you know where I'm coming from. Right now my level for mediocrity, my level for operating as if we're not in a pandemic is very short. And at this time we need to lead. We don't need to manage or operate as if we're not in a pandemic. And so the status quo is not something I'm going to be very comfortable with or engage with on a day-to-day basis. So, so please keep that in mind. If I'm getting into your business, if I'm asking specific questions, if I get a little flustered with the responses, it is because I'm trying to make sure we are as best planned, coordinated, and structured for what may come down the road that you may not know of yet because I have not been able to give you that information yet. And then success barriers for this whole management plan for the city. We have to maintain the volunteer support. We need to identify and be able to have volunteers on call for when these things expand and more people are in need. Food. We need to be able to establish support systems for food. The money donations is great, but if food starts to become scarce again, like it did last month, when everybody had the panic and the hysteria, having the money does us no good if we can't buy the food. We need to establish means of food from our local stores, from our restaurants that have food that they don't need anymore. We need to coordinate food going to COVID-19 disaster relief group, who is the official food program task lead, right? And then stress. If we created the task force for faith based because stress will be the next key issue. We can have everything in place, but if we don't enable and create means for people to relieve their stress, we don't create pathways for people to express their stress without making them feel bad about it, then we are doing nothing but creating another subsequent issue to the main one we should all be dealing with, which is the pandemic. And then instability. I put this charge to everybody right here because we're doing the same thing at the city. And this charge is, if it doesn't have to occur, don't let it. Right now, within this pandemic, we need stability. There's already instability in the shelter in place and how long that's going to last. There's already instability in the vaccine being created and when that's going to occur. There's already instability in paychecks that are going to be coming for people in the future. There's already going to be instability on how people are going to pay debts. Do we need instability with in areas where it may be nice to have this, but I don't, and it may have some type of negative impact on other people? I'm charging everyone that if you make decisions, think about the secondary and tertiary or third level of effect that those decisions will have. You know, if you are a big entity, I would assume that you would be speaking and talking with the emergency response team, emergency as we try to make sure it aligns with the efforts within their emergency management plan. And then lastly, as I get ready to close, is communication and transparency. Uh, I plan to continue to stay as communicative and as transparent as possible. Know there will be things I cannot share with you. Know that there will be things that I have planned to share based upon certain circumstances or certain situations, right? Also know if I am reaching out to you saying that I need to talk to you, then that is exactly what it is, right? I have information that you may not have. So if I ask to have a sit down and to talk and to inform, then take it what it's worth. It's the mayor of the city of Manor, who takes care of a population of 40,000 individuals in and outside the city limits in extraterritorial jurisdiction, is trying to make sure that the emergency management plan executes as designed and is tweaked as needed. So thank you. I know this brief went quite a bit. I'm also sorry for the technical difficulties that have occurred throughout this, but hopefully everybody got the information that they were seeking. Hopefully I provided some clarity on what we're doing, how we're doing, and how we're operating. And thank you. Please continue to do the social distancing and the shelter in place. Thank you.